What if the pill that's meant to protect your heart also leaves you with a cough that never seems to end? Or what if lowering your blood pressure comes with a dizzy spell every time you stand up? If you're taking Ramipril, or considering it, then these are questions worth asking. Ramipril is one of the most prescribed ACE inhibitors in the world. It's trusted to reduce high blood pressure, protect your kidneys, and even lower the chance of heart attack and stroke. For many people, it works quietly in the background, doing exactly what it should. But for others, it brings unexpected changes that can sneak up slowly or show up suddenly. If you've ever felt unusually tired, then it might be the medication, not just stress. If your lab results show higher potassium, then that could be Ramipril reshaping how your body balances electrolytes. And if you notice swelling in your lips or throat, then it's not something to wait on, it's an emergency. The point isn't to create fear. It's to give you clarity. Because when you know what to look for, you can tell the difference between harmless side effects and warning signs that need attention. In the next few minutes, we'll walk through 10 side effects of Ramipril you should know. The common ones, the surprising ones, and the rare but serious ones your doctor may not always emphasize. Now that we understand what Ramipril does, let's look at what might actually be causing trouble. If the medicine is helping your blood pressure but you still feel something isn't right, then it's worth asking, could Ramipril itself be the reason? Side effect number 1. Persistent dry cough. For many people, the first clue that Ramipril may be causing trouble is a cough that simply won't go away. Unlike the cough from a cold or flu, this one is dry, tickly, and stubborn. It can linger for weeks or even months, leaving many people blaming allergies, dry air, or the weather. But if that constant throat clearing stays around long after you expect it to fade, then Ramipril could be the reason. The science behind it is fairly simple. Ramipril blocks an enzyme that normally helps break down a chemical called bradykinin. When bradykinin builds up, it irritates your airways, and the result is that persistent cough. Studies show that up to 1 in 10 people taking Ramipril experience this effect, so it's not unusual. The cough itself isn't dangerous, but it can take a toll on your quality of life, keeping you up at night, interrupting conversations, and leaving you drained. Protecting yourself starts with awareness. If the cough doesn't improve after a few weeks, tracking your symptoms can help your doctor recognize the link. In many cases, switching to another blood pressure medicine, such as an ARB, solves the problem without the cough. So if your mystery cough won't quit, then it may be time to connect the dots and regain some comfort in daily life. Side effect number 2. Dizziness. Another side effect that often surprises people on Ramipril is dizziness or lightheadedness, especially when standing up quickly. If you've ever felt the room spin for a moment or noticed your vision blur as you get out of bed, then Ramipril could be the reason. Here's why it happens. Ramipril lowers blood pressure by relaxing your blood vessels. That's exactly what it's supposed to do, but if your pressure drops too quickly, then less blood reaches your brain for a short time, and that's when you feel dizzy. Doctors call this orthostatic hypotension, and it tends to happen more often when you first start the medication, when your dose changes, or if you're dehydrated. Now, the dizziness itself may not always be dangerous. But if it causes a fall, then it becomes a real risk, especially for older adults, where one fall can mean broken bones or hospital visits. Protecting yourself begins with small but powerful habits. If you rise slowly from a chair or bed, then you give your body time to adjust. Staying hydrated also matters, because even mild dehydration makes dizziness worse. If dizziness continues or leads to fainting, then keeping a simple blood pressure log at home can help your doctor spot patterns and adjust your treatment before it becomes a bigger problem. Side effect number 3. Headaches. Headaches may not sound unusual, but when they appear soon after starting Ramipril, they can feel confusing. If you've noticed a dull ache that lingers, a throbbing sensation behind your eyes, or even migraine-like pain that seems to appear out of nowhere, then the medication itself could be part of the reason. Here's why it happens. Ramipril works by widening your blood vessels so blood can flow more easily. That's how it lowers blood pressure, but the sudden change in circulation can sometimes trigger headaches. For some, it feels like pressure across the forehead, while others describe it as tension at the temples or a pulsing sensation that comes and goes. The encouraging part is that these headaches are often temporary. As your body adapts, the discomfort may fade within a few weeks. But if the pain is strong, frequent, or disruptive, then it's worth addressing. Protecting yourself starts with simple steps. Stay hydrated, cut back on alcohol, and watch stress levels. If the headaches keep returning, tracking when they occur, whether in the morning, after meals, or at night, can help your doctor identify patterns. Sometimes a dose adjustment, or switching to a different blood pressure medicine, makes all the difference. So if your headaches feel new or different since starting Ramipril, then it's worth connecting the dots and protecting your peace of mind. Side effect number 4. Diarrhea and digestive issues. For some people, the stomach is the first place Ramipril makes its presence felt. If digestion feels unpredictable, or you notice looser stools shortly after starting the medication, it might be more than just something you ate. It could be a side effect of Ramipril. ACE inhibitors like Ramipril can sometimes alter the way your gut manages fluids and electrolytes. When that balance shifts, food may pass through your system faster than usual, leading to diarrhea, stomach cramps, or general stomach discomfort. These effects are usually mild and temporary, but persistent diarrhea can quickly become draining. Frequent trips to the bathroom not only leave you feeling exhausted but can also increase the risk of dehydration and low blood pressure, which may make the medication's effects stronger than intended. Managing these digestive changes begins with staying hydrated. Drinking water or electrolyte-rich beverages is essential if fluids are being lost. Following a bland diet, such as bananas, rice, and applesauce, can also help soothe your stomach while your system adjusts. If digestive issues continue for several days, or if blood appears in your stool, contact your doctor promptly. Keeping a journal of foods and symptoms can help determine whether the cause is diet-related or linked to Ramipril. Even mild stomach changes may be your body signaling that this medication is affecting more than just your blood pressure. Side effect number 5. Nausea and vomiting. Nausea is one of those side effects that can sneak in quietly but quickly take over your day. After taking a dose of Ramipril, you may notice your stomach turning, waves of queasiness building, or even find yourself rushing to the bathroom. In many cases, the medication itself may be the cause. Ramipril doesn't just act on blood vessels, it also influences how your kidneys manage salt and water. For some people, this change increases stomach sensitivity. For a few, the discomfort remains mild, but for others, it can escalate into vomiting. Beyond the immediate misery, this can make it harder to stick with treatment, especially if the pill becomes associated with feeling unwell. Protecting yourself starts with spotting patterns. If nausea tends to occur when taking Ramipril on an empty stomach, having it with a light meal or snack may reduce the reaction. Staying hydrated is also important, as dehydration can worsen queasiness. However, if vomiting becomes frequent or you struggle to keep food and fluids down, it's time to act. Repeated nausea can affect nutrition, weaken the body, and even disrupt blood pressure. Keeping a symptom diary helps your doctor adjust your dose or consider alternative treatments. If your stomach keeps turning after each pill, don't ignore it. Ramipril may be quietly disrupting your routine. Side effect number 6. Fatigue. Fatigue can be one of the most frustrating side effects of Ramipril. If you've ever started the day with good intentions but found yourself running out of energy halfway through, or if simple tasks suddenly feel like climbing a hill, then your medication could be part of the reason. Here's why it happens. Ramipril lowers blood pressure by relaxing your blood vessels. While this protects your heart and kidneys, it can also mean less oxygen-rich blood reaches your muscles at times, leaving you drained. On top of that, the way Ramipril shifts electrolytes in the body may contribute to a feeling of constant tiredness. This isn't the ordinary fatigue that comes after a long day. If you feel unusually exhausted even after rest, or if naps no longer refresh you, then it's worth questioning whether Ramipril is playing a role. Protecting yourself begins with balance. If you pace your activities and build in short breaks, then you can conserve energy. Staying hydrated and eating nutrient-rich meals also helps your body adapt. For premium patients, keeping a daily log of energy levels alongside blood pressure readings gives doctors valuable clues to fine-tune your dose. So if your always tired feeling doesn't match your lifestyle, then it might not be you. It might be the pill meant to help you. Side effect number 7. Allergic reactions. Sometimes Ramipril shows up on the skin before anywhere else. If you've noticed a red, itchy rash that doesn't fade, or small bumps that appear without a clear reason, then your body may be reacting to the medication. For some, it's mild and looks like irritation. But for others, it can be a warning sign of something more serious. Here's why it happens. Ramipril changes the way certain enzymes work in your body, and for a small group of people, this triggers an immune response. That response may appear as a rash, hives, or swelling. If it's only mild irritation, then it can feel like dry skin or a random flare-up. But if you see swelling in your lips, tongue, or throat, then it could be angioedema, a rare but serious allergic reaction that needs emergency care. Protecting yourself means paying attention to how your skin behaves after starting treatment. If the rash is minor, then your doctor may suggest monitoring it or switching to a cream for relief. But if it spreads, feels painful, or comes with swelling or trouble breathing, then you should seek medical help right away. So if your skin starts telling a story your doctor hasn't heard yet, then don't ignore it. It may be Ramipril revealing itself in ways you didn't expect. Side effect number 8. High potassium levels. One of the less obvious side effects of Ramipril happens inside your blood, not on the surface. If your routine lab tests start showing higher potassium levels, or if you suddenly feel weak, notice tingling in your hands, or experience an irregular heartbeat, then Ramipril could be the cause. Here's why it happens. Ramipril affects how your kidneys handle sodium and potassium. By holding on to more potassium, the drug helps lower blood pressure, but sometimes the balance tips too far. This condition, called hyperkalemia, may develop quietly. At first, it might not cause any symptoms, but if potassium climbs higher, it can disrupt muscle function and heart rhythm, making it potentially dangerous. Protecting yourself means being proactive. If you're taking Ramipril, then regular blood tests are essential to catch rising potassium early. Avoiding salt substitutes and potassium supplements without your doctor's approval is another key step, since these can push your levels up even more. If you notice new muscle weakness, unusual fatigue, or a flutter in your chest, then don't dismiss it. Share these symptoms with your doctor, because adjusting your dose, or pairing Ramipril with another treatment, can bring potassium back into balance. So if your body starts sending subtle signals of weakness or irregular heartbeats, then it may be more than stress. It could be Ramipril quietly shifting your chemistry. Side effect number 9. Kidney problems. Ramipril is often prescribed to protect the kidneys, especially in people with diabetes or high blood pressure. But here's the twist: if your kidneys are already sensitive, then the same pill meant to safeguard them can sometimes make their job harder. Here's why. Ramipril works by relaxing blood vessels and changing how blood flows through the kidneys. In most people, this reduces strain and preserves kidney function. But if your kidneys are weak, dehydrated, or already under stress, then the reduced blood flow can tip them over the edge, leading to problems like reduced urine output, swelling in the ankles, or a sudden rise in creatinine levels on lab tests. If you notice your legs or feet puffing up, or if your urine becomes less frequent or unusually dark, then it's time to pay attention. These may be early warnings that your kidneys aren't handling the medication well. Protecting yourself means staying well hydrated, avoiding excessive use of NSAIDs like ibuprofen, and getting regular blood and urine tests. If any results look off, then your doctor can adjust the dose or consider another medication to keep your kidneys safe. So if the medicine designed to protect your kidneys leaves you feeling swollen, tired, or off, then don't overlook it. It could be Ramipril sending an early signal that your kidneys need a closer look. Side effect number 10. Low blood pressure. Ramipril's main job is to lower high blood pressure, but sometimes it can work a little too well. If you've ever stood up and felt the room tilt, noticed sudden weakness, or even fainted after taking your pill, then you may be experiencing low blood pressure, also known as hypotension. Here's why it happens. Ramipril relaxes your blood vessels, making it easier for blood to flow. But if the effect is too strong, or if you're dehydrated, just had a dose increase, or are taking other medications that lower pressure, then your blood flow to the brain can dip. The result? Lightheadedness, blurred vision, or even collapsing in severe cases. This side effect can be particularly risky for older adults, since one fall can mean broken bones or hospital stays. But anyone can feel its effects. If you notice dizziness when rising quickly, then slowing down your movements can give your body time to adjust. Drinking enough fluids and avoiding alcohol also helps stabilize your pressure. Protecting yourself goes a step further, keeping a home blood pressure log. If your readings show numbers that are too low, then your doctor can fine-tune your treatment. So if Ramipril leaves you feeling faint instead of steady, then it may be lowering your pressure more than your body needs. Ramipril can be a powerful ally for protecting your heart and lowering blood pressure, but as you've seen, it doesn't come without side effects. Some are mild and manageable, while others need quick medical attention. If you notice changes in your body that don't feel right, then listening to those signals is the best way to protect yourself. Every person responds differently, and the goal is always balance, relief without unnecessary risk. Stay aware, stay informed, and remember, your health decisions work best when you and your doctor are on the same team. If this video gave you clarity about Ramipril, then consider subscribing for more science-based health insights. A quick like or share helps others who may be taking the same medication. Staying informed is powerful, and together, we can make health choices a little clearer.